Victoria Atkins is not somebody you might have noticed. She is currently the health secretary, and of course she's fighting for her job. And she became health secretary in November 2023, so she's barely been in the job. She was preceded by Steve Barclay, who moved on to the Department of Environment, Food and Rural Affairs. And she has spent much of her time fighting with the junior doctors, the British Medical Association, over these strikes, managing the anticipated winter pressures on the NHS. And her appointment came at a time when the NHS was under considerable strain, with waiting lists at a critical level, ongoing disputes over healthcare workers' pay. And she has done almost nothing. She's achieved almost nothing. And now that her job is on the line, that she's threatened with a loss of a career and a loss of direction, she's suddenly come up with the one thing that she should have been talking about a year ago when she first got the job, the issue of whistleblowers in the NHS. And it's been a significant concern for years, and nobody has really dealt with it. Jeremy Corbyn's brother briefly took on a case which was very interesting, and I've looked at it as well, where the judge has said a contract is not contractual, which is absurd. And one of the problems with the whistleblowers in the NHS is that they face not only the savagery of the NHS system and the government, but also the connivance, it appears, and the nastiness and the long haul of a legal crisis to try and get some sort of resolution. And the only people who benefit from that legal battle are the lawyers. And something may be legally right, it doesn't make it morally right. And that is really the crunch. And our legal system, it may be correct as far as the law is concerned, but the more I observe it, the more I think it is sadly lacking in direction and purpose. Its purpose is there to serve the people. At the moment, it serves itself. It is an onanistic and self-obsessed institution, and it needs to get rid of some of the nonsense and start recognizing its duty. Its first duty is to the people, not to itself. And it needs to recognize the laws that are already in place to protect whistleblowers and respond adequately to that, and make their submissions significantly easier to process. As it is, they're up against a wall, and they are already, in the cases of the people who I know who've spoken to me, they're already in a state of major despair and penury because of what they've already gone through. They face severe professional and personal repercussions. They're exposed to unsafe practices in the workplace and in the law, and they are threatened with misconduct by the healthcare system. The Health Secretary, Victoria Atkins, has said today in the Telegraph, she said that she's going to investigate the treatment of whistleblowers and that this could lead to crucial reforms. Well, I hope that when the Labour Party get into power next week, that they will pick up this terribly important idea, particularly given the fact that the Labour Party is led by a barrister. And I'd like to instance three examples. Dr. Raj Muthu, who's a cardiologist who was dismissed in 2010 for raising concerns about overcrowded conditions at Walsgrove Hospital in Coventry, where he believed his patients' lives were endangered, and his case became one of the most well-known whistleblower stories in the NHS, and after a long legal battle he was vindicated and awarded significant compensation for wrongful dismissal. But it was fairly obvious from the beginning. Why did he have to go through such a long legal battle to prove that he was simply trying to assist, trying to help? And for trying to help, he was pilloried and punished. And the system punished. The system which was there to help him punished him as well. Dr. Chris Day, an emergency medical doctor who faced a prolonged legal battle after raising concerns about patient safety because of inadequate staffing levels at Queen Elizabeth Hospital in Woolwich. His case highlighted issues with the legal protections available to NHS whistleblowers, particularly around the definition of who is covered under existing legislation. Dr. David Drew, a paediatrician who raised concerns about patient safety in Walsall Healthcare NHS Trust, and after sending a prayer to colleagues to motivate better teamwork, which management deemed inappropriate, he was dismissed. His case raised questions about the NHS's tolerance for internal criticism and the appropriateness of its responses. This is a monolithic organisation, the NHS, which does not tolerate anything that questions its authority. And although in the plan that you sign when you become a member of the NHS, it says that you should be calling out bad practice, it doesn't tolerate those calls. It illustrates a pattern. These three examples illustrate a pattern where NHS staff who raise legitimate concerns find themselves sidelined, embroiled in costly legal battles, and out of a job, and that is unreasonable and absurd when we are facing such shortages in staff in the NHS. And more than that, the amount of money which is piled on by the government, by the NHS England and all that sort of rubbish, to defend themselves against the indefensible, when there simply is not a case to answer. This is an absurd waste of public money. Absurd. And it takes its cue from the deny, delay, defend, which is from insurance. Why are we surprised? Because insurance, the pattern of insurance dominates the NHS. If we weren't attacking whistleblowers, we would have more money for people. And we should listen to what whistleblowers say, even if they're not entirely correct. If there are whistleblowers, there is a problem. And the investigation promised by Victoria Atkins could lead to much-needed reforms that would not only protect whistleblowers, but would also protect us. It would encourage a more open, a more accountable healthcare system. We need access to our real records. I remember I was in hospital in Coventry, surprisingly, and my care was messed up because the hematology department didn't listen to what I was saying, and so they gave me the wrong drugs, and they didn't take into account the fact that I am on the haemophilia spectrum. So 2 weeks after, or 10 days after my cancer surgery, my wounds opened up, which was terrifying. My front room looked like an abattoir. And it took 9 hours, I think, before an ambulance finally arrived. I was incapable of moving. And I was losing pints of blood. And I was worried. I was then taken to the hospital. I was left on a gurney all night next to an open window, which I couldn't shut, without a blanket, and then told to leave the following morning, with nothing done. And I begged for help. I eventually got it, and I was readmitted, and I spent another 2 weeks bleeding in the hospital. None of that needed to happen if they'd paid attention, and if they'd actually consulted with other trusts, particularly in Oxford. But even when I was being treated for an appendix in the John Radcliffe in Oxford, they couldn't be bothered talking to the Churchill Hospital in Oxford, which dealt with my blood. And again, mistakes were made. And so I feel I have skin in the game. I feel I have a reason to be aggrieved because the system doesn't work. The system is so dominated by management that the people who actually do the work don't have an opportunity to think and don't have an opportunity to process and don't consult. And when I started bleeding, I bled all over my notes, and I asked my GP if I could have a copy of my notes, and what I got back was something entirely different, which had been overworked and modified in the light of my recovery. Completely modified, so that in fact the cancer details that I was initially given were completely different to the ones I received from my GP. Completely different records. And I drew attention to this, and the GP practice really isn't interested. But if you can't have consistent records, then there's no point in having the records at all. You might as well just invent them on the spot. If you have to have consistent records, and they have to be accessible, and they have to be the same. And the problem with the NHS is the variety of bureaucracy and the failure of bureaucracy. The utter failure of bureaucracy. And if we spent a little bit more money getting our bureaucracy right rather than attacking the whistleblowers, if we spent a little bit more money paying the junior doctors rather than attacking the whistleblowers, we would have an NHS that worked. If we spent a little bit more time caring about the people who are actually working in the NHS, rather than giving them the bureaucratic jobs to do, which should be done by the bureaucrats, because doctors not only are doing their doctoring, they're also filling out all this form work and box ticking, much of which is unnecessary and much of which can be done by other people if it needs to be done at all. We are building a mountain, a paper forest of rubbish which isn't consistent. If it were consistent and if it were clear, then maybe there would be an argument for keeping it. But it isn't consistent, it isn't clear, and I'm not the only victim here. There are many. And as I say, when I talk to whistleblowers, I'm appalled by what they have suffered and the nonsense of the bureaucracy. How is it that you can say a contract is not a contract, or contract is not contractual? It's in the word contract. So part of the problem with the NHS is a problem with bureaucracy, with nomenclature, with words, with things on paper. Either something is a fact and is true, or it is not. But if you've got two different documents that say two completely different things, then of course there is room for doubt. And why would you have two documents that say completely different things? Unless either you're trying to cover your tracks, which I suspect, or you're trying to muddy the water so nobody knows what's going on. And if you're muddying the water in the NHS when people's lives are at stake, this is wrong.